Before inserting a nasoenteric tube, review your client's history for any possible contraindications for inserting the tube, such as nasal problems like nosebleeds, nasal polyps, chronic sinus infections, or oral, facial, or sinus surgery, any history of aspiration, or anticoagulant therapy. If you find any of these conditions, discuss the situation with the provider.
Hi, my name is Angela. I'm going to be your nurse today.
Ensure privacy and place your supplies near the client's bedside. Perform hand hygiene. Use 2 acceptable identifiers to confirm that you have the right client.
Can you tell me your name and date of birth?
Brooke Baxter, 313.
And you're allergic to Keflex?
Make sure a suction device and catheter are available in the room, in case your client vomits during the intubation, and for use in case of aspiration. Review the provider's orders for the type of tube and enteral feeding, and discuss the procedure with the client.
About the procedure?
Yes, we did.
Do you have any questions about it?
No.
Okay.
Don gloves. Since the gastrointestinal tract is not a sterile body cavity, inserting the nasoenteric tube is a clean procedure. Having all equipment ready at the bedside makes the insertion of the tube more efficient and safe.
I'm just going to put the head of the bed up.
The high Fowler's position reduces the risk of aspiration and promotes effective swallowing. Make sure the height of the bed is at hip level.
Okay. I noticed in the chart that you didn't have any past medical history of nasal trauma or surgery, but I just wanted to verify that with you. Have you had any recent infection, nosebleeds, or any trauma?
Assess your client's nasal passages. Use a pen light to assess each nasal passage. Look for any obstruction, such as nasal polyps, irritation of the mucosa, or septal defect. If both nares are patent, ask the client which side she prefers for tube placement. Arrange your supplies and equipment. You need a stethoscope, a pen light, and a bath towel for your client. You need an anesthetic agent, if allowed at your facility.
Tickle here. I'm just going to set up the equipment.
Place a bath towel over your client's chest. You need a cup of water with a straw or ice chips for your client, pH reagent strips, an emesis basin, a tongue blade, a permanent marker, a cup of water to dip the lubricated tube in, and scissors. You need tape or an attachment device to secure the tube in place, skin adhesive, and water-soluble gels to lubricate the first 4 inches of the nasoenteric tube. You need a 60 milliliter or larger syringe to check tube placement and to flush the line. You need a tube fixation and anchoring device to secure the tubing. Open the tube's package and prepare the lubricants. Place the emesis basin and facial tissues within reach and available to your client, as the insertion process can cause gagging and tearing.
I'm going to hand you the basin and the cup of water.
Assess for a gag reflex by gently placing a tongue blade against your client's uvula. This should elicit a gag response. Doing this helps you determine your client's ability to swallow and her risk of aspiration.
Go ahead and open your mouth. Say a big ah. Okay. Now we talked about communication while I'm inserting the tube. I want you to go ahead and raise your index finger if you're having any discomfort or want me to stop at any time. Okay?
Measure the correct portion of the tube to insert by measuring the distance from the tip of the client's nose to her earlobe to the xiphoid process of her sternum. Mark the length with tape or a permanent marker. For duodenal or jejunal placement, add another 20 to 30 centimeters or 8 to 12 inches. Coat the tip of the tube with a water-based lubricant. Have your client breathe through her mouth as you slowly insert the tube through the nares to the back of the throat. Advance the tube each time your client swallows until you have inserted the predetermined length.
Okay, now I'm going to have you take a deep breath in.
While passing the tube through the nasopharynx, ask your client to flex her head toward her chest.
Go ahead and swallow and put your chin to your chest.
This action closes off the epiglottis and reduces the risk of the tube entering the trachea. You can also rotate the tube 180 degrees while inserting it to facilitate its passage and prevent friction-induced damage to the mucosa membranes. Advance the tube each time your client swallows until you insert the predetermined length. If you meet resistance, significant coughing, gagging, choking, or changes to your client's vital signs, pull back on the tube until your client recovers.
Keep swallowing.
Use a tongue blade and pen light to look at the back of the client's throat.
Okay, can you open your mouth and say a big ah for me?
Ah.
Say another big ah.
Sometimes the tube becomes coiled or kinked in the client's mouth. If this happens, pull back until the tubing is taut and then reinsert the tube. Anchor the tube to the client's nose to avoid pressure on the nares and to reduce traction on the nares if the tube is moved.
This is a little skin adhesive to help it stick. I'm just going to let that dry for a minute. Are you doing okay?
Yes.
Okay.
Auscultate for breath sounds.
Just going to go ahead and listen to your lungs. Can you take a deep breath in for me? Another deep breath in. And can you sit up forward? Take a deep breath in. Another deep breath in. Okay, good.
Withdraw gastric aspirate. Assess the appearance of the aspirate and its pH to help confirm placement.
Okay, I'm going to go ahead and take the towel away.
Gather and dispose of all waste in the appropriate receptacle. Remove gloves. Mark the tube directly below the nares with a permanent marker. Fasten the tube to your client's gown by looping the rubber band around the tube in a slip knot.
All right, hold on just a sec.